Hello, everyone. It's my pleasure to give the topic on behalf of China Doha Society. The topic is about nutrition and lifestyle modification before conception and during pregnancy. We want to prevent the non-communicable disease in China or over the world. As we know, the incidence of non-communicable disease is high and trends to be younger. This is the prevalence in China of the overweight and obesity among the children and in China is more than 18%, and also hypoglycemia increased during the past 10 years, and also the total prevalence of dyslipidemia in Chinese children and adults also high. So we all know that epidemiology studies across a wide range of countries and over many years have come the observation that early human development affects risk of non-communicable disease in late life. That means pre-conception period, pregnancy, and infants are windows of particular sensible to environmental cues which influence lifelong trajectory across health and disease. Findings from large observation studies in various populations and experimental animal studies have identified different modifiable risk factors in early life. Adverse maternal lifestyle factors, including overweight, obesity, unhealthy diet, and also the behavior, smoking, or alcohol, and stress in preconception period and during pregnancy as the more common multiple risk factors leading to suboptimal in uterine and for fetal development and late disease. So early human development affect risk of non-communicable disease in late time. And how can we do maybe the potential preconception and the maternal and the health factors include the poor nutritional and also the obesity. Maybe we can change, and we just want to reduce the risk for the screening disease. So here we just show obesity or overnutrition is a major problem during pregnancy, which is becoming much more prevalent in both high-income countries and also low and medium-income countries. For the mother, being above obesity can lead to gestational diabetes and also hypertension. For the infants, maternal obesity increases the risk of prematurity birth and also stillbirth, deaths, congenital malformation, and the problem with glucose regulation in first few days of life. And the maternal obesity can lead to lifelong problem for the after screening, including much high risk of obesity, diabetes, heart disease, stroke, asthma, poor cognitive performance, and other non-communicable disease. So for the obesity and the overnutrition, is high in China now, and also the obesity and the overnutrition is very severe. The public health in all over the world. The obese mothers have obese, the children in the repeating style, just give the worker cycle. So many studies focus on bariatric surgery, and the outcome of pregnancy showed that women undergoing bariatric surgery at least 2 years before conception have considerable low risk of the diabetes during pregnancy, and also the hypertensive disorders, and the largely for gestation age newness compared with women of similar BMI who have no surgery before the conception. Although this was particularly offset by more small for gestational age. Of course, now most of the obesity women cannot get the surgery. Maybe we can change the lifestyle, including the nutrition and the exercise before conception, and also the during pregnancy. While the obesity epidemic is growing, maternal undernutrition remains a critical public health problem, and the potential consequences of undernutrition are just as harmful as those of overnutrition and obesity. In China, both of the overnutrition and the undernutrition are very common. Maternal underweight is likewise associated with upstream growth and development, including increased risk of preterm birth, low birth weight, and 5 mortality, and poor mental and physical development. Another major public health problem that affects women of reproductive age is anemia. It has been associated with increased risk of poor birth outcome, including low birth weight, preterm birth, and also of gestational age, stillbirth, and other complications, and also adverse maternal outcomes. So from the globally 29% of non-pregnant women and 38% of pregnant women are anemia. So how to prevent anemia is very important before the conception and also during pregnancy. Here is some of the data from our research group. And this is a study is in 21 hospitals, including 15 centers in Beijing, 5 centers in Guangzhou, and 1 center in Chengdu. The overall prevalence of anemia was 23%, and adverse pregnant outcomes, including gestational diabetes, polyhydramnion, and the preterm birth, and the low birth weight, and then also neonatal complications and neonatal ICU admission increased significantly in those with anemia than those without anemia pregnant women. So, despite the reduction in prevalence of underweight, deficiency, including iron, vitamin A, and iodine, zinc, and calcium, remain prevent the consequence of micronutrient deficiency. Women of reproductive age, including period, physical, and cognitive performance and reduce immune response. Calcium deficiency may contribute to pregnancy-induced hypertension. A lot of studies focus on how to give the calcium during pregnancy to prevent the hypertension and also preeclampsia. Additionally, they have increased risk of complications at delivery and premature birth with low birth weight or small gestation age. In such iodine, the intake in pregnancy is considered principal cause of preventable mental impairment in their newness, and these two serious dysfunction and risk for budget in adults. So this was stress both maternal and weak and overweight, malnutrition and nutrition, hypoglycemia, anemia are associated with the risk for after screening health. How can we do? From the life course model of non-communicable disease, we can see the risk of chronic non-communicable disease is increased. That means the greatest range in terms of reduction of risk can be achieved through a timely intervention in early, especially during pregnancy and also the early years old. Such the perinatal period extended from conception to infant offers a unique opportunity for the promotion of global health through the prevention of the chronic adult disease. So healthy diet and nutrition, weight management, physical activity are among conception and pregnancy priority, especially by the WHO. FIGO calls for increased awareness to adolescents, preconception, and maternal nutrition in 2015, and strongly recommends that pregnant women have early access to prenatal care to receive appropriate nutrition consulting and intervention. In China, we give a lot of the lectures around how to improve the pregnant women nutrition, and also we give a lot of the preconception consulting for the women in China. FIGO recommends promotion of viable and healthy diet as the first step to meeting the nutrients needs of adolescents, girls, and young women. It is critical that micronutrient deficiency are recognized and rectified through intervention, including diet and also and the supplement as appropriate. FIGO recognize body weight and important effects to women's nutrition status. Underweight women may be lacking in a number of important nutrients, and their diet should be clear access and supplements as required. Obesity itself comfort risk for adverse outcomes. Furthermore, overweight and obese women may have poor quality life that high in energy but low in nutrients value. Both of these conditions can negatively affect pregnant outcome. Such figure recommends that attempts be paid to preconception or early pregnancy body weight and BMI that be taken to modify weight by improve the diet and encourage appropriate levels of physical activity. So it is very important to give the consulting before pregnancy for the underweight and also overweight or obese. We just want to give the the consulting and also give the physical exercise the advice before pregnancy and keep the weight to the normal level. And also in China, we take the physical activity, the guidelines last year. We just want the pregnant women can keep the physical activity. Women with uncomplicated pregnancies should be encouraged to in aerobic and stress completing exercise before, during, and after pregnancy. Regular physical activity during pregnancy improves or maintains physical fitness, helps with weight management, reduce the risk of gestational diabetes in obesity women, and enhance the physiology well-being. An exercise program, as I mentioned, also published in China, and we hope the exercise program lead to eventual record of the moderate intensive exercise for at least 20 to 30 minutes per day. And most of all these of the week should be developed for all the pregnant women. Here we just show some of the studies in China. One study is the prospective, the randomized clinical trial to evaluate the effect of exercise during pregnancy to prevent gestational diabetes and improve pregnancy outcome in overweight and obese pregnant women. For these studies, we collect more than 300 women, and we give the exercise 3 times per week, and at least 30 minutes with a range of perceived exercise between 20 to 5 to 14. And also we use a cycle program from the early pregnancy until the 37 weeks of gestation. Those in the control group continue their rural diet active. Both the group receive the standard prenatal care. So this is the primary outcome, the gestational incidence among the overweight and the obesity. So you can see for the exercise group, the prevalence of GDF in reduced almost 46% compared to the control group. And the second outcomes, we also compare with the between the two groups. We can find the less gestational weight gain by the 25 gestational weeks and at the end of pregnancy, and reduce insulin resistance levels at the 25 gestational weeks. And other the secondary outcomes, including the hypertensive disorders, cesarean delivery, and also the gestational age at birth, preterm birth, macrosomia, and large for gestational age infants are also lower in the exercise group compared with the control group, but without a significant difference. However, currently studies, especially RCT, focus on the influence of lifestyle intervention in early life on short-term and long-term maternal and after screening health outcomes are still have major limitation and do not show strong effect on maternal and after screening outcomes. New and innovative approach are needed to move from describe these causes of ill health to start tackling them using intervention approach. Further randomized control lifestyle intervention studies and innovative observation studies using the design are needed to focus on the effect of an integrated lifestyle advice for the preconception onward on pregnancy outcomes and long-term health outcomes in offspring on the population level. In October 2016, Chinese government released the Healthy China blueprint. The pilot shift from medical care to nutrition and health promotion. One of its goals is to strengthen intervention and continuous health service or promote with focus on entire population and the whole life cycle, including women, children, and elderly. In this context, we applied for a national project, effect of maternal and endocrinology and metabolics on early life health of offspring and its key mechanisms. And this project has received approved 20 million yuan. On this project, we are working on lifestyle prevention studies during pregnancy, such as lifestyle intervention during pregnancy to prevent the recurrence of gestational diabetes. We use a smarter food containers, which is designed to equal pregnant women with the means to simplify the food recording process and provide nutrition and diet recommendation by comprehensively assessing in the gestational weeks with body composition and physical activity and pregnancy complications by placing food on the smart plate and taking photos to upload. The app can intelligently identify the type and amount of food in the meal and calculate the nutrients complement. I compare the caloric and nutrients intake with the original diet recommendation provided. The app will give us personally diet advice. Additionally, the APP can provide the receipts every day, and the patients can choose food in the same category according to their taste habits. Importantly, AP can generate a diet report, and participants can transmit the report every evening to our computerized research database, and then receive the individual feedback from our clinic team regarding her daily diet every evening, including weight. Additionally, collaborating with Beijing Academic of Artificial Intelligence and the Institute for Air Research Center, we also developed smartphone APP based on lifestyle coaching program that integrates with diet, physical activity, weight, and glucose monitoring to prevent excessive gestational weight during pregnancy and optimize lifestyle in women with overweight and obesity or gestational diabetes. We also run another project. The project is carrying out in 60 medical institutes at a different level in 10 provinces in China. Guidelines for maternal nutrition and health service will be published according to the project and implemented throughout the country. So, furthermore, we just want to put this project to all over the China in next 5 years. So, just one say, China has the largest population in the world, and its health levels greatly affected the healthy development of the population of the world. China Doha Society will go forward hand in hand with the International Doha Society, seeking ways to continuously improve early life health and the health of the population. Here we just want to thank all of you, and also thanks the Doha Society and also the China Doha Society. Thanks all the members of our research team. Thank all of you.
Thank you so much, Professor Yang, for that wonderful talk and very interesting description of your fantastic studies that you're doing in China. Particularly the Healthy China Plan is really very interesting. I'm just going to remind everyone that is online right now to please put your questions into the Q&A, and we have about 10 more minutes to engage in a discussion and answer some questions. So before we get to the questions themselves, which I will read out for you, Professor Yang, I was wondering if you could speak to regional distribution in micronutrient deficiencies across China. I noticed that the Guangzhou province had a very high prevalence of anemia. And I wonder if in the China plan, whether there will be regional differences in the way that you implement changes in nutrition, or do you plan on doing it the same across all provinces?
Okay, thank you. The good questions. In China, we have the same nutrition, the recommendation all over the countries. For example, we give the suggestion for the low dose the folic acid supplement before the conception and until to the first the trimester. That means from the before conception until the 12 gestational weeks. Since that, if some patient want to take the multiple vitamin, maybe some pregnant women do not continue take the multiple vitamins, but for the low dose the folic acid, all the pregnant women should take before the pregnancy. That means if they have the planned the pregnancy, they begin to take the low dose folic the acid before the pregnancy until the first trimester.
Great. Yeah, great. Thank you for answering that. And I think that answers one of the questions that we have in the Q&A asking about folic acid and for the first 12 weeks. I'll just follow up that question with whether or not does the China plan have any room for addressing any of the paternal impacts, and how do you feel about both maternal and paternal intervention before pregnancy?
Yeah. You know, now in China, maybe we do most consulting for the maternal, but for some the intervention or the advice also for the partners if they come to hospitals, and for the public health the recommendation we give the both the couples stop the smoking, alcohol intake, and other things. If the fathers is very obesity, we also give advice to change the lifestyle. But most of the time we do the intervention just focus on the maternal, not for the partners.
Great. Yeah, thank you. Well, it's nice to hear that you are giving advice to the couple regardless. So, okay, I'm going to just read the questions in the Q&A. We'll go through them. Someone is asking, should we focus nutrition intervention among teenagers rather than pregnant women, and what do you think about that?
Yeah, this is very interesting, the questions. I think we should pay more attention to the teenagers' health lifestyle. You know, in China, especially in the rural area, a lot of the teenagers maybe take more the high caloric the food and take more the juice, including the high sugars. So, and also in China, the overweight and the obesity is very high recent years. So if we use the intervention from the teenager, especially for the young girl, it's very important, not only focus on the pregnant women, but it's very difficult because we cannot have the consulting for the teenagers. We just do a lot of the public, the health, the papers and give announcement how to keep the health lifestyle for the young teenagers. And also we do a lot of the talk to the public about the early life can change the futures for the to prevent the non-communicable disease. That means how to keep the health lifestyle from early life, especially for the teenage. Thank you.
Yeah, yeah, it's certainly important for us to address it on a community scale, as well as during the time that people intend on becoming pregnant, of course. Yeah. So we have another question just about the intervention with nutritional and physical activity. And I also was wondering about the app. I wonder, can you just clarify, is the intervention and the monitoring on the mobile phone? And I'm interested in understanding also about the use of AI that you said in terms of monitoring. And I wonder if you could just expand a little bit on that.
Okay, good questions. Wang Chen will answer this question. Thank you.
Okay, sure.
Okay, now we have just developed the AI equipment for the smartphone study. We want to use the smartphones to help us to do the intervention during pregnancy, to help us to manage the pregnant women to have a good gestational weight gain during pregnancy, and want to prevent their adverse pregnancy outcome. Because I think that for using a smart, can give our reply to the mothers in time. Because without the smartphone, they can only come to the hospital, and so based on the smartphone, it's much more easily for them to contact the doctor and have the advice from their doctors. Yes. For the smartphone app, we have some parts such diet advice, and the physical recording, and the nutrition suggest, and the glucose monitoring. So we want to use the smartphone to help the pregnant women to have a good diet, and have the moderate exercise during pregnancy, and have a good have the right gestational weight gain during pregnancy, and have a good outcome. Yes.
Yeah, wonderful. That's great. Thank you. Thank you so much. So another question about the exercise studies. And I also had a similar question. If you could just let us know what type of exercise is in the exercise study. We noticed on the slide that you had individuals on the bicycles, and is that the type of exercise that they will be doing? And will you be looking potentially at different kinds of exercise? And I wondered about weight bearing versus non-weight bearing, so on a bicycle versus walking, or using weight-bearing exercise. Maybe you could tell us a little bit about that.
Okay, thank you. I see that the question from Robert Warland. Hello, time no see. Okay, now, thank you very much for the good question. And this is a collaboration work with the Western Australia University. So they have before the study, they have used the bicycling to study the effect of bicycling to prevent the recurrence of gestational diabetes mellitus. So this is a collaborative work. So we want to use the bicycle to prevent the GDM in overweight and obese pregnant women. So in this study, we only used the bicycle, but as Professor Yang has introduced, we will do some prevention study in the future, such as intervention for the recurrence of gestational diabetes mellitus in China, and to help to build a good health for the obesity and women that have high plasma glucose in the first trimester. In that study, we think we will use exercise such as the walking. Yes, because you know that for the exercise study we introduced in our slides, every patient need to do the exercise in our hospital, and we have doctor or scientific nurse to modify. So when they do the exercise, they need to come to our hospital, and we need to, yes, we to see to monitor them when they do the exercise, because we worried about the safety of the exercise they doing. Yes, but based on the study we have conducted that within our slides, we think that exercise during pregnancy is safe. So maybe in the future study we will use the bicycle and walking and some exercise to help to do the intervention and help pregnant women to have a good physical activity during their pregnancy.
Yeah, great. Thank you. Very comprehensive answer. Thanks for that. So we're just over time, but I will ask, there's at least two questions in the chat about breastfeeding. So one question asks about breastfeeding rates in China and whether or not you controlled for breastfeeding in the studies when you do your analysis.
Yeah, because the time I could not mention the breastfeeding in China. Now, in different the cities, the prevalence of the purity feeding rate is different. But for the more than 30% for the breastfeeding during the first months, but we hope we can increase the incidence for the feeding rate to the 50%, and also the government gave a lot of the promotion how to increase the breastfeeding rate in China, including increase the maternal leave after delivery, and also we give the special time after the delivery, and want the mothers gives breastfeedings longer, more than the 6 months. So in cities, sometimes it's difficult, especially for the professional mothers. But in area is better in the urban areas.
It's quite important to be able to give people the time, right? So that they have time to do what they need to do. It's critically important. So there's one other question just about applying DOHAD theory in the real world, and I think that is the big question for everyone and the whole society. about how do we go about applying what we know about the biology into our communities. And our communities are very diverse across the whole world. So all of these implementations will be quite different. And Professor Yang, I will give you the last word for the webinar if you would like to say anything to this question about applying DOHAD in the real world, and then we'll wrap it up. So please, what are your last thoughts on DOHAD in the real world?
Yes, thank you for these questions. In China, maybe we introduced the DOHAD, the theory later in the Western countries. But I also remember in 2005, the David Bucks visited China and also gave a lot of the lectures in China at that time. And since then, a lot of the doctors, especially for the obstetrician and the pediatric doctors, are very interested in the DOHAD. And also we do a lot of the lectures of the China. Recent 10 years, more and more the doctors and also the public health workers focus on the DOHAD theory to transfer the clinical practice. Mm-hmm. So, you know, in China, we have the the whole lifestyle and the health and give a lot of the space for the early life. That means the first 1,000 is very important, the window to change the later lifestyle, including we give a lot of the preconception consulting, especially for the diabetes patient, overweight and obesity women. We want to change the lifestyle for the high-risk populations, control the blood glucose, the levels, and then pre-pregnancy, and also control the weight before pregnancy. But also very difficult because in some areas, especially in rural area, most of the women cannot do the exercise, the physical exercise every year. So they don't know the chronic disease, so they cannot do the intervention before conception. And also, if the pregnant women with hypoglycemia or the nutrition maybe increase the baby's growth and also increase the risk for the chronic adult disease. So we also do a lot of the prenatal care, the guidance, and just want to do the better the prenatal care and control the birth weight, because you know in some area the birth weight is the birth weight most the 4 kilograms is very high 10 years ago. And we just try to establish the nutrition consulting during pregnancy and also establish the GDM care and want to control the blood glucose during pregnancy. That means we want to give the intervention before pregnancy for high-risk population and also do better the prenatal care for all the pregnant women, want to give the ideal the weight gain during pregnancy and the tightly the blood glucose control for all the hypoglycemia. Then we want to reduce the macrosomia. That means the large gestation age, and also reduce the small for gestation age. So just keep the balanced nutrition for all the pregnant women. And also we promote the breastfeeding for all the infant, and also keep the good nutrition for the infant. Also, we want to induce the cesarean section. That means we do everything to change the early life health. And we want to reduce the chronic disease in the future. So in China, more and more the women, the pregnant women think the DOHA is very important, and also the news connection, and also the government give a lot of support to do the research, both clinical research and also the basic research. So we also establish some of the cohort studies. We just wanted to know which the approach is better for the long-term health. So I think in China, even difficult to transfer the DOHA theory to the clinical practice better now compared to the 20 years ago, because that time a few of the doctors know the DOHA but no thing very important. But also a lot of work needed to do how to promote the DOHA, how to do the intervention, how to follow up the after screening in the future. Maybe we should get more evidence from China, because before a lot of the research result based on the epidemiologies, maybe from the Western countries. Right now, we also collect some of the data from the China. I think this is very important. The theory we should announcement to all of the persons, not only the the healthcare the provider, maybe also for the public.
Yeah. Thank you, Professor Yang. And I am sure that because of all your work and your team's work in increasing the awareness of DOHAD is why 20 years later so many more people know about this. So congratulations to you and your team on your achievements for doing so. It's certainly very important for everyone, as you say, including the public, to know about DOHAD, and it is up to us to be able to do that. So congratulations again. Thank you so much for giving us such a very comprehensive talk on the work that you're doing in China, and we thank you for joining us today. And I'll thank everybody here, all the members, for joining us and asking such great provocative questions. And with that, I will close the webinar and wish everyone a very good day, evening, and week ahead. So thank you again, Professor Yang, and also to Dr. Wang for joining us this morning and this evening. Take care.
Thank you, everyone. Thank you.
Bye-bye.
Bye.
Bye-bye.